New at 5, patient services cut and employees shown the door at D.C.'s only hospital serving 177,000 people who live east of the Anacostia River. These are employees at United Medical Center who say the siphoning off of care is leaving patients with nowhere to turn. Our Delia Gonzalez is live in Southeast at the site of the new hospital, which is slated to replace UMC. But Dee, the problem here is that facility is not open. So the question is, where do these patients go for care?
Certainly a concern for so many in this community, including the dozen employees that we talked to earlier today. You know, Les, I've been working the phones all day to try to get a firm date as to when Cedar Hill Medical Center here behind me will open. I'm only getting early 2025. District leaders assured us there will be a seamless transition for UMC patients. But now I'm hearing there will likely be a gap in care. We're talking maybe weeks, even months, a gap in care that could be at least months long. And of course, that leaves many wondering what happens to our neighbors who will be left in this medical limbo. It started with a phone call from one woman.
We care about the patients.
And in less than 24 hours, Tracy Williams gathered a dozen current and former employees of United Medical Center to talk about their concerns of mismanagement, retaliation, and cuts to patient care.
What am I supposed to do?
Employees received this August 14th memo that in anticipation of the hospital's closure next March, 10 patient services, including surgery, cardiology, rehab, and mammography, were being suspended at the end of the month. But they say the services were shut down August 20th. With as little as 10 days notice to patients.
People come in, sometimes they're having a stroke. We don't have neurology. Time is life.
I'm here to enforce the contract.
Plus, the unions are concerned that long-term employees are being let go in violation of their contract with no guarantee of their severance.
Because we worked hard for it.
The troubled hospital has been plagued with financial mismanagement and poor care. That's why district leaders promised residents a new beginning with a brand new hospital. But that promise is yet to be fulfilled. In the meantime, communities that face disproportionate health disparities are left between a construction site and a hospital that is winding down operations. These employees say too soon.
This was a good hospital. Management's running into the ground, the mayor is running into the ground, and D.C. Council is running into the ground.
All right, so just 30 minutes ago, I heard back from UMC. UMC got back to me just 30 minutes ago. They say that emergency department and inpatient services will remain open until this hospital, Cedar Hill, is online. They go on to say that they notified employees back in May of general service cuts to the hospital, but they say they also notified patients within 30 days. But get this, Councilmember Christina Henderson, who chairs the Healthcare Committee, she says they are required by law to give patients 90 days notice of any service cuts. It appears they may be in violation. I also heard back from the Deputy Mayor of Health and Human Services, sent me a statement saying he's working with UMC leadership to, quote, ensure that there will be a safe and coordinated transfer of any patients requiring medical care when Cedar Hill opens. We're here live on the campus of St. Elizabeth's in Congress Heights. Delia Gonzalez, USA 9.
And you can believe, Delia, we are going to stay on top of this because we know what happens to our most vulnerable citizens, and it will not happen on our watch.